The following video here is a soft tissue release guide for the TFL or Tensor Fascia Latae. This muscle lies on the front of the hip, and it can tend to inhibit your ability to externally rotate the hip, so this is going to be relevant for things like the squat. So if this is something that's inhibiting you, the following is a means of auditing which side is tight and how to actually locate the trigger points and get rid of them. How we start this release is by first setting up the audit, and this is called the Z-sit position. So how we set up the Z-sit, one heel is going to go to the knee, the other heel behind me that you can't see is going to go right to your butt cheek here. And you want to be able to sit comfortably in this with a completely upright back here. You want to try to get your the side that you're stretching as close as you can to the ground. So now in this position I can keep my spine relatively upright. I don't feel anything really in the front of the hip, but now I'm going to compare side to side. So as we switch positions here, what I find is that getting into this position is a little bit more difficult. I'm actually feeling quite a bit of a pull in the front of the hip here, and as you can see here, my spine is starting to tower and I can't quite get my hip to the ground here. This is your indication of the area that you want to address. So using a kettlebell, you want to use something that's moderate weight. This right here is 25 pounds. Anywhere from 15 to 35 pounds would be a good weight to start with here. But what we want to do is actually flip it upside down. The kettlebell handle is going to go pointing right towards the hip joint itself, along the front, about the area where the pocket of your pants would be. In this position here, we want you to tripod yourself back like this, taking some slack out of the hip here. And you will play around with the angle of the kettlebell until you find something that's acutely tender or tight. So it will take some thorough scanning, but you will find a spot like right here that I found here. This point in particular, what you want to do is actually leverage your torso into the weight of the kettlebell. So now the weight of the kettlebell handle is driving my hip joint down into the ground, and it's getting my butt just a little bit closer here. You're going to feel a very deep release in the hip. Now if you feel a sharp pain, or if the kettlebell is too heavy, you can actually do damage with this stretch, so exercise a bit of caution. It's always best to go light as far as the weight of the kettlebell is concerned, and scale up as your body size would indicate. So you're going to want to hold this position for anywhere from 45 seconds to a minute. And at that point you can let go with this back arm, again tripod back here, take some slack out of the hip, scan around here until you find another acutely tight or tender spot. Again, you're going to leverage your torso directly into the kettlebell, trying to force your butt cheek on this side down to the ground. And again, holding for 45 seconds to a minute. This you can do on both sides, but if you scan through and don't find anything, the Z-sit audit position is a great way to identify which hip is limited in internal rotation.